Hi, this is Dr. Chobot at Covington Veterinary Hospital to talk to you about what to expect for your cat's spay.
What is a spay surgery for cats?
Yeah, spay surgery is a total hysterectomy, and that means we remove the whole uterus and the ovaries so that your cat can't reproduce or be in heat anymore.
Why should you spay your cat?
Yeah, it's really important to spay your cat. Certainly, behaviorally, they're going to be a better pet for you. There's a lot of crazy behavior that cats will exhibit when they're in heat. Also, she'll be a healthier cat for that spay. That means that she won't have risk of ovarian cancer because the ovaries are removed, less risk of mammary cancer, and no risk of infection in her uterus called pyometra.
What are the risks of spaying your cat?
Yeah, of course, there's some risk with surgery as far as incisional infection, but there's really minimal risk for cats for the surgery other than incisional infection or reaction to anesthesia.
And what age should you spay your cat?
The typical answer to spay your cat, I'm going to recommend that you spay them by 5 to 6 months of age, and that is to prevent them from coming into heat and having all those crazy in-heat behaviors.
What does the spay surgery include?
Yeah, the spay surgery includes an IV catheter and fluids. It includes pain medication to keep your pet comfortable. It includes the anesthesia, and that's monitored by a registered veterinary technician. And it includes the veterinarian scrubbing in sterilely with a gown and gloves, cap and mask, and a sterile surgery pack, and the patient clipped and scrubbed for the surgery and draped sterilely as well. And then that includes the surgery where we remove the ovaries and the uterus. It includes lasering the abdomen after surgery to reduce pain and speed healing. And it includes monitoring in the hospital afterwards and dismissal later in the afternoon.
What is the spay surgery recovery like?
The spay surgery recovery typically is about 7 to 10 days of trying to restrict your cat's activity. The first night home, you may want to feed half their normal meal because they may have an upset stomach from the anesthesia. And then the tricky part is preventing them from licking the incision site. And that may mean an e-collar or an inflatable cone or a surgical bodysuit. And you may want to get them used to that before their surgery so that they're comfortable in their recovery. And any further questions, feel free to contact us at Covington Veterinary Hospital.